Who has the first spooky story, spooky dental story?
Well, when I remove the acrylic denture, we can see another denture, but another denture of food. Yellow, too yellow. Everything.
And the patient went like this. Lunch.
No.
He said like that, lunch. And the thing when he went like this, I heard him chew.
Delicious.
And I see something coming out under the jacket. That's true, eh? That's true. Something coming out like an insects.
When the doctor shows him the tooth, the patient just goes,
Oh, really?
and all of a sudden we're freaking out. Hello, welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Spotify and we're on Apple Podcasts. We want to thank you so much. We're over 1,000 followers, subscribers. And it's all because of you guys. You know, keep on sharing, keep on telling your family members, your friends about us, and let's keep this going. Remember, this is all to educate everyone and everybody be in the right track. So today we have Dr. Mitch with us. How you doing, Dr. Mitch?
Hi, guys.
We have Dr. Michelle,
Hi.
Dr. Alonzo,
Hi, Frank.
and we have Dr. Luis.
Hello, Frank.
So now we're going into October. We're in October. And it's a spooky season. So we wanted to start with something, spooky. Dr. Spooky's still on vacation as we speak. So Dr. Spooky will be here.
We miss him.
And we miss Spooky.
Dr.
Who is him? Who is him?
Dr. Ivan Spooky.
Ivan is spooky.
And we want to talk about things that you guys have seen on patients, things that you've seen on patients that you didn't think you were going to see, things that you have experienced. We're going to talk about different things like that. And who wants to start it off? Who has the first spooky story, spooky dental story? Well, not all of them. Oh, there you go. Everybody wants to speak today.
What's the first one?
Okay, he's going to be the brave one. See, there you go.
Okay.
Well, one basic problem.
Basic.
Yes,
The
basic.
It's very common.
Yes.
Yeah.
Is when the patient arrived to here with one bridge, and the bridge is in the implant and single tooth and natural tooth, so it's terrible.
Terrible.
Yes, that's not possible.
That's spooky on the dental world. That's spooky. Okay.
Yes.
It's because it's incorrect, because the correct solution is one implant with one implant.
Yes.
Okay, you can do a bridge or implant and implant, but you cannot do implant and natural teeth. That's impossible. It's not correct. You can check on books or on internet. It's not correct.
Yes.
Correct.
Okay. What's another thing that you guys
It's a
have
basic.
experienced?
I have a lot of bad experience, but I remember a very bad experience with one patient when I removed the immediate load, the temporary denture. Oh my God!
Oh.
That was long time ago. Or
Yeah,
or
Yeah,
yesterday.
yeah.
long time ago.
Probably 1 week ago.
Yeah.
Or a couple hours ago.
Well, when I removed the acrylic denture, we can see another denture, but another denture of food. Yellow, too yellow, everything.
I'm not gonna post the picture, obviously, but it was a lot of different colors in there.
Yeah,
There was yellow,
yellow, green.
green. I seen
Yeah.
a little bit of black.
New colors.
I can see something moving.
It hits lunch.
I'm pretty sure Papa Smurf was living there. It was, and
Spiders coming out.
Spiders coming out. Yeah.
and it's very, very important to keep it clean. You know, we tell our patients, keep your dentures, your immediate loads, your final hybrids clean, because I seen that, and that was, well, I have one, and you guys know it already, but our patients don't know it.
Mm-hmm.
A while back, there was snap-in dentures were very popular.
Yeah.
Yeah.
So everybody wanted to snap-in dentures, and this patient came in, and he had snap-in dentures, and I guess they got it done like 6-8 months before, and they came in for a checkup. Nothing hurt. Everything was good. Okay. And when we took off the snap indenture, the implants looked like they were not clean. They were dirty, but it wasn't that bad. But when he turned the denture around, we seen all the food that had been there for months, and we asked him, "We have to be cleaning here," and he said, "Oh, it's because they've never taken it off in 8 months."
Wow.
And there was a lot of leftover food. And there was a little bit of greenish, yellowish. And the patient went like this. Lunch. No. He said like that, lunch. And the thing when he went like this, I heard him chew.
Delicious.
So it's I still my wife go, "Oh, don't tell me.
No.
But it's something that we have experienced here quite a lot. And then the patient tells you, "What? I've been cleaning, right?" Or no, I don't smoke. I don't smoke. And then you're just like,
no.
"And what is this, ma'am?
Yes.
Are you chewing?" What's another story, guys? What's another story?
I have well, it's very common, like you see, that the patients always say that I have a root canal in this tooth, and I take an X-ray and I take a look, and they don't have nothing. And they're like, "No, they told me they do a root canal. I pay for a root canal."
No.
And me, really? Are you sure it's maybe another tooth? No, I'm very sure they opened my tooth. They do a root canal, and I see nothing in there. In the X-ray, we don't see material. We don't see nothing.
Nothing.
It's not the root canal.
Because the root canal looks like a white line.
A little white line.
inside the
It's a white line.
canal.
Yeah.
Yes.
In the canal.
And the canal.
In other patient, like the same situation, and she told me, "Open my tooth and see how it seems. What they do, I don't have pain anymore."
Yeah.
And I was okay. And there inside was like cotton.
Cotton. Yeah.
Cotton.
Oh my God.
Cotton only, and when I open it, it smells
Smells,
awful, and the cotton was black
A lot
because
of
the
bacteria.
infection.
Right.
Yeah.
They only clean it, and they
Yeah.
put only cotton, and that's
Cotton, and that's it.
yes.
Yeah, oh my
and
God.
that's that root canal.
Yeah.
Yes.
Wow.
Yes.
Wow.
What about you,
Bad,
Alonso?
bad.
You're very quiet over there.
I have one really good. That was like 3 years ago, 4 years ago, probably.
It was July 25th to be exact.
And there was another clinic here on. Really bad experience because I was doing a diagnosis. Well, just the patient take a seat in the chair and we make an evaluation, take some X-rays, and I see something coming out under the jacket. That's true, eh? That's true. Something coming out like insects. Or how is
Spider?
Bugs or what?
Bugs. Bugs.
Insectos.
Bugs.
Insects, yeah.
Yeah,
Yeah.
insects coming out. Right there. And I see, you have something right there. Oh no, it's normal. It's normal. and she's like inside. And then I
come
see
on.
her all around the
body.
the body. Yeah, that was like a really. And well, the last thing was think about in the solution of the teeth, right? That was like just go to your take a shower.
Take a shower, please.
Take a shower.
This is
please.
true. This is true.
It's the first step.
So,
Wow.
obviously we deal with a lot of infection.
Yes.
And a lot of times it's patients, it has nothing to do with the patients, right? But a lot of times it smells pretty bad. Okay.
Yes.
What do you guys do? So they say someone opens their mouth, it's not their fault. Or sometimes, there's patients that it is their fault and they know it's their fault and it's a different type of smell.
Yes.
Does your face mask actually cover it, or what do you guys do in that situation? Do you pray? Do you get one of the little things that you put in the dryer so it smells good and you put it inside your mouth? How does it work?
When it's,
I
think
close my nose.
when it's too bad,
To be honest.
yeah,
Yeah.
When it's too bad, I use two masks,
A double mask.
a double mask.
Yeah.
Double
Yeah.
mask or only put I put Lysol in all
Lysol,
the
yeah.
in all the share, but like a lot of
Lot,
Lysol.
yeah.
And to
Yeah.
me, in the I don't care.
Yeah, yeah.
And then I pass the patient.
Right.
I do that.
Oh, you know
only
what?
it's because the smell.
Yeah.
Yes.
You know what? This is the first thing to do. You have to rinse your mouth first, and then you have to open your mouth, and
Rinse,
you're gonna
it's
see.
maybe
So
a good thing
with
to
some-
rinse
With
out.
an antiseptic.
Yeah.
Sometimes the cleaning is the first step on the
Yes.
first day.
Yes.
We can see you tomorrow, not today. By tomorrow looks better, everything.
Yes,
Yeah.
and they look better.
They
The
look- they
gums
look better,
are not too with a lot of inflammation.
So then
Yeah.
you guys don't do it till the next day, but you let the assistants do the cleaning?
yeah.
Yeah.
Wow. Team
Yeah.
players.
Yes.
Wow. 1, 2, 3 team.
Only sometimes. Only
sometimes.
sometimes.
Wow.
No, not for me. Too much for me.
It's too much.
It's too
Yes.
much.
I remember one time we had a patient come in, and the patient said they wanted to get like a bridge, and they were talking about how they had their work done somewhere in New York, and our doctor looked and she said, "These are temporaries," and she's like, "No, I had them done a year ago," and she goes, "No, these are temporaries." And we took X-rays and we showed her it was temporaries,
Mm-hmm.
and she showed us her receipt and her email, and she paid everything.
Wow.
So she called back the clinic, and we helped the patient show that it was only temporaries, and she actually did a lawsuit, and she won. So she had her teeth done here.
Yes.
But yeah, they had charged her. She was probably like 70 something, and they probably said, I don't know if they forgot or they just try to take advantage of it. I don't know.
Wow.
But that was pretty scary.
Yeah.
It's just scary. Yeah.
Other situation is when the kids of 6, 7 years arrive to here with the first permanent molar,
Molars. Yeah.
with a big hole, with a big cavity, and the first molar have 1 year in the mouth. No, it's possible, and it's common. So this is a big problem.
Yeah, yeah.
So
Too much candies.
So you're saying that once their baby tooth falls off, their grown-up tooth comes out, and then that one has a big cavity already? Is that what you're saying?
Yes. Yes. Uh-huh.
Yes, and
They
in
don't
the-
keep it. Mhm.
Yes.
And we need, even when a root canal it's not working, we need to pull it out.
So then they will not have their tooth there the rest of their life.
Maybe when they put an implant, like in
Yes.
18 years when I have it.
So I have a question for you guys. Are cavities, let's say I have a lot of cavities in my mouth. Let's just say I had 28 cavities.
Okay.
Are cavities contagious?
With the saliva.
Okay.
Mhm,
Yeah.
The pH.
pH.
The
The pH
pH
is
can
the
be
first.
the problem.
So what if
Problem.
I drink from here
Mm-hmm.
and I'm drinking, and then I let my son.
There is bacteria.
There's bacteria. They
Yes.
can happen.
That is one of the most common things that I've
and
seen.
the kiss of
Yes.
son.
The
Father
father and
kisses.
kiss, yeah.
Mother that kiss her boys
Yeah.
or her girls.
On the mouth?
Yes.
Yes.
Can cause a lot of problems.
Yes,
to
the
children.
cavities.
Yeah.
Yes, the bacteria. You can.
You told me yesterday, right?
Yes.
We are talking about that.
Wow.
We have bacteria in,
Yeah.
in mouth for sure, and then we kiss
Kiss.
a
Someone else.
girlfriend or something else, and the bacteria are compatibly.
Yeah.
Compatible.
The
They
relationship is better.
They have match. They make
Yes.
Yes.
It's a chemic.
When,
a chemic.
It's a chemical. When I actually looked it up a year ago, they said that, infection, a cavity's infection.
Yes.
And the number one, do you guys know what the number one infection, the most contagious infection is?
No, me no.
The most contagious infection in the world at the time was diarrhea.
Okay.
If someone has diarrhea in your house and they're not lysoling every time they go to the bathroom, there's a big possibility someone else is going to get it.
Okay.
But do you know what was number 2?
Cavities.
Cavities were number two.
Cavities.
Oh, wow.
Yes.
As the most contagious.
Streptococcus.
Cavities.
So
Streptococcus.
I see this a lot. Have you seen little kids, 5, 6, 7? Their teeth are black.
Yes, it's
All beat up. You're like,
horrible.
well, why? Well, obviously they're not brushing and they're drinking a lot of sugar. But then, in the Hispanic community, what I've seen is we drink. Oh, here you go. Have some.
Yes,
Yes.
And we give in normally.
same.
I mean, everybody has their own cup. We're good. But a lot of people here share with their kids. Oh, they drink from the same cup.
Yes.
What if they have cavities and they're gonna be a lot more aggressive on a baby
Yeah.
tooth?
yes.
Yes.
That's a good.
And then you
That's a
just
good point.
And then all of a sudden the kids, I mean, they have all these kinds of cavity, but it's not just their fault. It's also the parents.
Parents, yeah.
It's always fault of the parents. Always.
Yes.
Always. They are very little. They
It's
don't
like
know
a
it.
culture, a bad culture.
Culture, yeah, it's a bad
Yeah.
culture.
A bad culture.
Yes. Right.
Yes.
Yeah, that's
The
It's dangerous for the
dental
kids.
education is the most important on the first years.
Yes.
Yeah.
Very important.
Yes.
and coming on that. I have another story. One time, we had two friends come in, two guy friends. Okay, they're young, probably 25, 28, kind of big. And one of our doctors starts working on it, and one of them needs his teeth pulled. Okay. And one of them, one of the friends is very scared, and the other friend's like, he's like, "Can you please be here for me?" So the other friend's standing there. The surgery is good, everything's good. Pop out the tooth, and then the friend's like, "Oh, show him his tooth." And when the doctor shows him the tooth, the patient just goes,
Oh.
Really?
and all of a sudden we're freaking out, like, "Oh my gosh, we're freaking out! Oh my god!" And, we, getting everything we need, going all the protocols, and then all of a sudden he gets up again, and he's like, and he almost falls off the
Again?
chair, and I'm like, "Oh my god, let's get a doctor or whatever." We're taking his blood pressure, and his friend's laughing, and I'm like, "What?" And then whenever we're like, "What happened?" He's like, he's just scared of blood, so whenever he sees blood,
Wow.
he faints.
Yeah.
Yes.
And his friend knew about it, and on purpose told us to show. So every time this guy would come back
It's
and
just
see
a
his
ketchup.
tooth,
Dude.
Again.
he would fall again. But he was big,
Yeah.
so I mean the chairs are big, but not that big.
Yeah.
So he's like this. He's almost hitting the doctor at the same time,
Knockout.
and it was like, oh my gosh.
He cannot see the catsup.
The only one laughing there was his friend and nobody else was laughing. I was like, oh my gosh, man, that really scared us. That was pretty scary.
That is common. That is very common with the assistants. With the first day of the doing this job, assistants, when they see a lot of
Blood.
blood or when we expose the bone and
Surgery.
all those surgeries, is for the assistants like, oh my god,
my
what are you
God.
doing? That
What are you doing?
You're gonna
Yeah.
kill him.
are you
Do you
killing?
remember?
Why?
You're gonna kill the patient? No, it's just relax.
Stop, please.
It's a normal process.
Yes, no,
He's
problem,
looking at
yeah.
you like a murderer.
Yeah.
You are a monster.
What are you doing?
Like Charlie, no?
Yeah, like Charlie. Yeah.
say, you're gonna kill the patient. You're gonna kill the patient. No, it's normal, bro.
It's gonna be okay.
Yeah.
Con un machete, viernes 13, así. De terror.
I know.
Wow.
Other situation is when the patient want veneers or crowns, but the tooth is moving and the gum is bleeding. No
There
is
have been
possible. First is the hygiene, and after of the
Yeah.
hygiene is the aesthetic.
when the patient wants veneers and his teeth look like this,
Yes.
Yes, with that mud
they're
position.
like, "Can I get some veneers?" And the teeth are like they're fighting. The teeth are fighting each other.
Yes, no, guys.
It's not impossible.
It's like their teeth are all
please.
hugging,
Please.
Yes,
and they're like, "Oh, I seen it online, and they could do it."
Yes.
yes.
No, you didn't
No,
see it
it's
online.
not-
I don't know
not-
where you seen it.
It's not a good job, that.
No.
It's and they're like, "No, I think you could do veneers," and we're like, "No, I think we can't. No, we can't. No, we can't."
That I think that procedures that they think they can do it, it's only put like what? It's
Composites? Or?
composites only inside, but it's not to work. You don't have hygienic.
Yeah.
The food is going to stuck over there. The gum is going to bleed too much. It's
Yes.
not possible.
Yeah.
It's not. It's a liar. It's a lie.
It's a lot. It's very important,
Yes.
to get educated. Get
Yeah.
educated. And if you don't believe the dentist you went to, go to another dentist. And they're probably gonna tell you the same thing. But go to a good dentist. Don't go to just a dentist that's gonna just wants to take you for your money and is an order taker. Oh yeah, I'll do them, and then
Yes.
it's gonna be a worse case.
Yes.
So, have you guys ever been inside someone's mouth and see something move? Like, I always had that question. Like I don't know. Like, I see videos of people that have worms and stuff. Has there ever been something like that you guys seen in someone's mouth that it moves or
Not
or
yet.
squirts at you?
Not yet, but
No,
like
not yet, yeah.
pus, it's
Pus.
like the pus.
It's common.
When I open a tooth, it's not to be a common thing, but
Wow.
I see pus inside the tooth
But
coming out.
Doesn't squirt.
Yes, they open, and when I open, they grow up. I'm gonna pass you a video. I have one video. I guess I like it. I don't know, but I like it, and I'm recorded. And this was I open and it's like a grano,
Like a pimple.
like a pimple. It's like a
yeah.
pimple, but in the tooth. Oh yes, it's very disgusting. And the patient, I want to finish today. Oh my God, not. You have a bad infection.
Yeah.
I can seal it. I can finish it.
Yeah.
Because one time I finished one root canal like that, and then the other day they come with her eye like this, very inflammation.
Yeah.
And the patient don't see. They don't see it. His upper eye was closed.
Close, yeah.
Closed because the infections migrate to the upper part. And I need to reopen the tooth, re-clean it, and I can finish the root canal.
Okay.
And you know, the patients that understand it the least are the ones that need it the most.
Yeah.
Like, I need this done in 3 days. And you're like, so you want me to pull your teeth, and you want me to put immediate loads, and you want me to do this, do that, do this, do that in 3 days. What you've done in 35, 40 years, you want me to fix it in 3
Just
days.
3 days, yeah.
Yeah.
And they expect perfection. Like, look, we're going to need this time, we're going to need that. Or the people that tell you, well, can you just do my root canal? And you're like, well, I need to open it up. I need to do medication. And then you come back later on or go back with another, wherever, if you can't come back and get it finished. No, I need it done now.
Yes, the medication
And you're
need
just
time.
like, you know, I'm doing this for you.
I'm helping you.
You know,
Yes.
I could finish it, but I'm doing it for you
Right.
because it's gonna affect you.
Yes.
You know, I'm not doing it to waste your time. I'm still gonna charge you the same.
Yes.
You know, it's to help you out.
Help me to help you.
Yes.
Yeah.
Help me help you.
Yeah.
Help me to help you.
Of course.
Yes. There are patients that they understand that. This week I have one. I saved her tooth because she wanted. She waited like 2 weeks because I put medication. That tooth, it was really bad, really, really bad. I'll show you the X-ray.
Yeah.
And I was like, no, just pull it out. Me,
Yeah.
I was telling her.
You are the expert to
Yes,
save your
and
the
and
teeth.
she was, no, I don't want it. Please. Yeah, okay, we're gonna try. And yes, it works, but
Works.
we have the time.
Yeah.
We spend 2 weeks with the medication. She takes antibiotics, and she has her tooth and a crown. And that's it.
That's awesome. That's awesome. Well, we have so many stories. We have to go ahead and close out this section. Is there anything else you guys want to say? You guys want to send a shout out? You guys want to say something to our patients? This is your guys' time to shine. Anything?
The girl in the other clinic,
The-
in cosmetic.
The what?
The girl, the
A
child,
little girl
the
that
little
it
girl.
appears in the
Oh, yeah.
cosmetic
Right.
clinic.
Oh,
Yeah.
Oh, yeah, that's true,
They
huh?
turn out that turn out the TV, no? Turn it on.
She turned on the TV and put some like Simpsons or
Who turned
No,
I
it was always
Who
like
turned-
SpongeBob.
Yeah.
Yes.
So
Pancho.
there's a TV at our clinic in the back that always, at some point, but it stopped. But at some point would turn on at a certain time at night, and it would be SpongeBob on TV. And you guys know smart TVs don't go directly to a channel; they go to the menu.
The menu,
And this one will turn on, and it will go into Nickelodeon to SpongeBob
Oh my gosh.
every
Nickelodeon.
day.
And they,
Really?
then they see a little hands. They tell.
Yeah, that's
In
it.
the-
A little hand, yeah, and there would be no kids in the back.
Oh my god.
And always they pass that.
We had a video. I don't know where it's at, but
I think one of the assistants
yeah.
have it, a photo. I
I
think.
don't want to work too late.
No, you like it. You like to work
I
too
like
late.
the work, but not
that was another creepy story.
not that girl.
That's true.
Another girl.
No.
Yeah, no, that's great. No, we're gonna have more of these for sure. I have many other stories to tell, and I know I'm pretty sure that you guys have more stories. I'm pretty sure that different people have more stories, and we're gonna be sharing them all through the month of October, and yeah, well, we're gonna wrap this up. You guys want to say anything else before we leave? A bye, something? You guys good? No.
No, it's only thank you for our patience to seeing here.
Yes.
Our podcast is very important to us. Thank you so much.
Thanks for your time.
Thank you to understand the process. Thank you so much.
Well, in something that's not spooky, we're also opening Eternal Beauty. We're taking appointments now for Eternal Beauty. It's located inside Cosmetic, and George will put a little video on the bottom right now of the lobby. Dr. Michelle is going to be our leading doctor there. And we're going to be offering everything from hydrofacials to threads to Botox to Juvederm to lips to
Nose to jaw contouring.
it's whatever's. There's not very invasive things. It's,
No, it's gonna be like a eternal beauty, being natural, but beauty.
there you go. So
Yes.
you come in for a smile and you walk out looking 10 years younger. So it's a win-win. So this has been Supreme Dental, powered by Supreme. This has been Supreme Dental Podcast, powered by Supreme Dental, and now powered by Eternal Beauty also. And don't forget that smiling starts here.